The member for Higgins.
Mr Speaker, my question is to the Minister for Health. Could the minister please update the House on progress in securing and delivering safe and effective vaccines to all Australians?
The Minister for Health.
Thank you very much, Mr Speaker, and I want to thank the member for Higgins for her continued interest in the vaccine program, because it does matter for all Australians. This morning I had the privilege of visiting the Therapeutic Goods Administration, and along with the head of the TGA, Professor John Skerritt, we were able to inform Australians that 2 of the 4 vaccines which Australia has secured have already been placed on the provisional approval pathway. What does this mean? It means that they're being given an expedited process to approval, but subject to the most rigorous safety assessments, I believe, in the world. And the reason why this is important, of course, is that whilst Australia, on the latest advice I have from the National Incident Centre, has contained its community transmission to 6 cases in 7 days, less than 1 case a day, and the world, however, is seeing over 500,000 cases a day on average, and sadly we've seen 9,000 lives lost in the last 24 hours. So globally, the challenge is enormous. Whilst our containment practices are working, we know that we cannot be safe until we have a vaccine that will protect Australians, not just from the disease in Australia, but from the disease at the global level. So what that means is that this week we have seen the commencement of manufacturing of a vaccine in Australia by CSL. We've seen the very important news that one of the vaccines which we've secured, the Pfizer mRNA vaccine, is making extremely positive progress, and we're cautious still, but the progress is very heartening. And then today we've been able to announce that 2 of the 4 vaccines are already on the provisional pathway. The other 2 vaccines are expected to apply to be on that. And as Professor Skerritt said, that means that we are in a position that potentially by the end of January there may be approvals for rollout and delivery commencing in March. And our goal and our intention and our expectation is to ensure that every Australian who seeks to be vaccinated will be vaccinated during the course of 2021. And that is immensely important for jobs, for livelihoods, but above all else for lives and security around Australia. At the same time, we've been able to secure 134.8 million vaccine units directly through these purchasing programs, and another 25.5 million units through the COVAX facility. That means we have enough vaccines for 3 times the Australian population. We have enough vaccine future purchasing for 3 times the Australian population. So we're investing, we're preparing, and we're preparing to save and protect Australian lives.